My name is Shirley Murray. I'm a child development and education consultant for LACOE. I will be talking about active supervision of children. The supervision of children is our most important responsibility. How many of you are parents? Aunts? Uncles? Grandparents? Think about that precious child that you love so dearly. Our parents are entrusting their precious children with us, and they are counting on us to keep their children safe. OHS also takes active supervision very seriously and will be monitoring for it as they visit every single classroom. Please be vigilant. 3.5. Staff actively supervise children at all times. These are the exact staff behaviors and questions that reviewers will be observing for and asking about when they enter your classrooms and socialization locations. You need to be practiced and prepared to provide answers per your agency policy and procedures, which are in alignment with the LACOE gyms. Reviewers will attempt to interview classroom and home-based staff, but be very aware that your primary responsibility is to visually supervise children at all times, and you may need to redirect the reviewer to someone that is not directly supervising children at that time, so you do not take your eyes and attention from your children. You will be observed to see that you are within arm's length of children. For Head Start, that might mean positioning yourself close to children that need extra attention and is applicable to all children enrolled in Early Head Start. You will be observed for lapses of supervision. Always position yourself with the children in front of you. Do not turn your back on children unless your teaching partner is behind you. Make sure that no child follows the reviewer as they leave your classroom, whether indoors or out. Develop the practice of constant communication with your teaching partner. Become skilled at the practice of sender and receiver. That is, as a sender, I, the teacher, will call out to my assistant, "I'm sending Juan and Sarah to you to use the restroom." As my assistant, you will answer, "Okay, come on, Juan and Sarah. I'm now taking 4 children to the restroom," acknowledging to me, the teacher, that you have received them. I then answer, "Okay, 4 to the restroom." That way, when your supervisor, your director, LACOE monitor, or OHS enters your classroom and asks why there is a discrepancy between the number of children in the classroom and the whiteboard, you can give a quick and confident answer. Lastly, you must make sure that your play yard is safe. It is all staff's responsibility to examine your play yard to ensure that there are no blind spots. When you return to your site, work with your colleagues to walk around the play yard with a critical eye and look to see if there are any unsafe areas and report them to your supervisor. Then, as a team, discuss how everyone will work together to position themselves to effectively supervise the children and determine if there are any changes that you need to make as you wait for the maintenance to arrive. Don't assume that someone else will take care of it. Be proactive. 3.6. Staff use positive child guidance when responding to undesirable behavior. This has to do with children's personal rights. Know and follow your agency's policy and procedure on child guidance. The reviewer could ask you, but will definitely ask management, if any staff member in the past 12 months engaged in corporal punishment, emotional or physical abuse, humiliation, and/or employed methods of discipline that involved isolation, the use of food as punishment or reward, or the denial of basic needs. The protocol defines this as food, water, or bathroom privileges. If this has happened, your management will be asked further questions of their follow-up and if community care licensing has conducted follow-up as well. You will be observed for positive guidance practices. Apply your knowledge and practices of class emotional support. which includes positive climate, teacher sensitivity, and regard for student perspective. Ask for additional training if you are unsure about what this looks like. And now we'll review some slides from the Early Childhood Learning and Knowledge Center website, ECLEC. These slides are located in the Health tab under Safety and Injury Prevention. ECLEC has a great video that you can download and view titled Leave No Child Unattended. The web address is at the bottom of the screen. Why supervision matters. A child's safety depends on staff knowing where every child is at all times. We are responsible for the safety of the children from the time that the parent signs the child in and up to the sign out. OHS data tells us that children are more likely to be left unsupervised during transitions. Good supervision involves all of your skills as a teacher or home visitor. Your effective visual supervision strategies and techniques will create a safe environment for children. Supervision is your responsibility and commitment to the families who have entrusted you with their children. What is active supervision? Active supervision means having the right adult-child ratios and adults who are fully engaged and paying attention to the children in their care so that they can quickly get to a child who needs assistance. Effective strategies for staff include looking, scanning, and engaging children to prevent childhood injuries and lapses in care and supervision. It requires focused attention and intentional observation of children. When you use active supervision, you are positioning yourself so that you can see all of the children. You are conducting frequent head counts, especially before and after transitions, and listening at all times. You are using your knowledge of each child's developmental abilities and anticipating what children will do. That means for some children, you position yourself within arm's reach. The best way to keep children safe is for the teacher and home visitors to be actively engaged with children. Sounds familiar? Sounds like the implementation of the class, emotional support, classroom organization, and instructional support, and all the dimensions under each of those domains. Another factor is the constant communication with your teaching partner to make sure that no child is ever left unattended. OHS has provided us with 6 concrete active supervision strategies and practices that you can use to keep all of the children in your care safe and supervised, no matter if you are in center-based, family child care, or home-based setting. As we discuss them, think about your agency's policy and procedures, your training, and the distinctive needs of your site and the unique needs of some of your children. Think about how the strategies work together and ways you can apply them. Feel free to stop the video after each slide to further discuss your practices and procedures. Setting up the environment includes the creative curriculum layout as well as the selection of equipment and materials in the classroom, socialization setting, or family child care home. Early childhood environments are not static environments. Once adults and children enter the room, the environment constantly changes. In order to keep the environment safe and secure when children are present, staff must monitor and maintain hazard-free spaces. The layout of the classroom or area where children play in family child care homes or socializations or centers must allow the staff to see and hear the children at all times. Preschool interest areas or infant-toddler experiences must be set up in ways whereby they do not interfere with each other and allow staff to observe multiple centers at once. This means that there are no blind spots where children can play that you cannot observe. The materials and equipment that children use are developmentally appropriate, and their furniture and toys are in good repair. In this picture, notice that the light toys, like the plastic dinosaurs, are kept on the top shelf. It's best to keep heavy toys on the bottom shelf in case a child drops them. Items are placed appropriately to allow room for floor-time play and away from walkways. Setting up the environments is especially important for early Head Start staff, who create space for tummy time for young infants and designate separate areas for young infants away from areas for mobile infants and toddlers to engage in active play. Completing an environmental rating scale, the ECHRS, ITERS, or FECHRS, for your classroom is an excellent way to ensure that the classroom is set up for quality. Staff must position themselves close to the children, especially in infant settings. Repetitive systems for scanning and counting once young children become mobile can help you engage in responsive caregiving and support children's learning while keeping track of where children are at all times. For example, you may position yourself closer to a child who's struggling with keeping her hands to herself because her language skills are still emerging. Or a newly mobile child is eager to use the climbing structure on the playground, so you will want to stay within arm's reach to prevent the child from falling. A research study found that an adult's proximity to a child is one of the most effective ways to prevent injuries. So it's important to be intentional about where staff position themselves in the classroom and on the playground in order to be able to observe all of the children at all times. Staff must scan and count children constantly so that they always know how many children there are and where they are. Since we know that the transition periods are the most challenging, staff must be especially vigilant at these times. Scan and count before and after transitions with the other staff at your center so that everyone knows where each child is. It can only take a moment when children are moving from one place to another for a child to wander off or be left behind. While scanning and counting provides visual cues in your environment, you also need to listen carefully. Sometimes a specific noise or even silence can indicate that there is a problem and someone may be in danger. Being alert means being able to determine what sounds may signal an indication of trouble, such as a child who's getting frustrated and may be more likely to hit or bite another child. A bell on the classroom door is an audible alert to notify you that a child may have run out of the room. Anticipating children's behaviors can help you prepare for how children will react to transitions and changes in the daily routine so that you can determine which children may need more attention and extra support at any given time. Anticipating how to engage children in activities makes it easier to plan ahead for all possibilities. For example, if you know that some activities are likely to be popular, then you can set up the environment to encourage turn-taking by providing tickets for how many children can use a center at one time. You can also plan other activities that are engaging for children who are waiting their turn. You also anticipate children's behaviors based upon their developmental levels and the skills that they are working to master. For example, a young child with newly emerging language skills who is having trouble communicating may bite out of frustration and might need a little extra support. Lastly, when you include "tell the teacher when you need to use the restroom" to your class list of rules, other children will help monitor and enforce the rule and remind their friends. Throughout the day, teachers are engaging and redirecting children as part of learning. Student engagement is paramount to learning. This is fostered by building emotional connections with children and nurturing the development of approaches to learning. As adult-child relationships are built, teachers initiate a level of awareness and responsiveness to children's emotional and academic needs by individualizing assistance and choices based upon developmental levels. For example, helping a child who's struggling with turn-taking to learn how to share with friends. In addition to supporting the child's developmental and learning needs, staff can decrease children's challenging behaviors by providing positive behavior supports. Sounds familiar? It's your intentional implementation of appropriate class dimensions and behavior markers. These posters are also on the Early Childhood Learning and Knowledge Center website. At this time, I ask that you discuss as a program, as sites, and in classroom teams what you do as a group well, and what can you commit to improve. And always keep that precious child in your mind, because you know that as the parent is counting on you on seeing that child's precious face at the end of the class day. Thank you for your commitment to actively supervise children to keep them happy and safe.